carcinoma, a type that did not show up on 2 of Stamp's mammograms.
This is one of the problems with this type of cancer. It manifests itself as an infection, but it is not. It is, if you will, it's an infection by cancer cells.
Stamps immediately had chemotherapy treatments, followed by a mastectomy and 6 weeks of radiation.
And how are you going to identify an adverse clause?
When I returned back to work, it was 2 days after radiation.
Dr. McKinnon believes Stamp's persistence in treating the slightest change in her body saved her life.
Unfortunately, anywhere from 5 to maybe 10% of breast cancers don't show up on a mammogram.
Now she wants to help other women fight cancer.
My message is to keep your doctor's appointments, know your body, check your breasts constantly.
Today, doctors say Stamps is cancer-free, traveling the road she had intended for her life without fear.
This is what a lot of women have to put in their minds. They cannot think negatively. They have to know they beat this thing. I never think about it coming back. I beat this, Nancy.
For all women, the threat of breast cancer is very real. 40-year-old Cecilia Harlan says it hung over her like a black cloud. Last year, her twin sister Terry was diagnosed with breast cancer. A genetic test showed Cecilia had a 75% chance of also developing the disease. So Cecilia took matters into her own hands and tried to stop the disease in its tracks. Cecilia Harlan felt she was being stalked by an invisible enemy. She decided she was not going to go through what her twin sister Terry experienced fighting the disease.
After seeing Terry go through this horrific process and her losing her hair and the swelling and fatigue, and I knew I did not want to wait to develop breast cancer. I will do anything to avoid going through what my twin sister has gone through.
Cecilia made the choice to have both her healthy breasts surgically removed.
All my friends thought I was absolutely nuts. Why would you do this when you're not a cancer patient?
But 3 surgeons agreed with Cecilia's decision. What used to be considered radical surgery is being looked at in a new light, thanks to 2 recently published medical studies. Both examined high-risk women who had their breasts removed to keep them from getting breast cancer. The researchers found the women were 90% protected after the surgery.
But very few women, I will emphasize, very few women actually require prophylactic mastectomies. Many women who get breast cancer on one side want the other breast removed, and yet only a very few of those develop a second cancer.
Dr. Stoliar warns women of another deadly statistic.
Unfortunately, most people believe that if they don't have a family history that they don't get this disease. What they forget is that at least 90% of breast cancers are not hereditary.
So what can you do to protect yourself? Dr. Stoliar says half the women in America don't get mammograms to catch breast cancer in the early curable stages. He blames fear and denial.
It is not a rare event for someone to come in who is very bright, very intelligent, who has all the right answers, but who developed a lump and let the lump grow to enormous size, really to a size that's not curable anymore, and they knew about it the entire time.
Thanks, Dad. Okay. Cecilia says the issue for her was one of control. She wasn't going to let the threat of breast cancer control her life. She has no regrets having a mastectomy.
I feel like this black cloud of cancer is not over my head, following me everywhere. I felt like cancer is just following me everywhere, and now it's gone. I am so relieved that I had this preventative surgery.
Coming up, we'll take a look at some programs geared towards saving women's lives, and you'll see the future of breast health. We'll show you a state-of-the-art center aimed at making the patient more comfortable. We hope tonight's program will help ease the fear many women have about getting a mammogram. Early detection can save your life, but you have to be the one to take the first step. Every woman should be armed with the tools to protect herself against breast cancer, even those who don't have access to health insurance. In Louisiana, a program is in place to screen women most at risk for free. This is the St. Thomas Health Center on St. Andrew Street, one of 2 contracted clinics for the Women's Preventive Health Program. For 7 years, the program has been called one of Louisiana's best-kept secrets.
All they have to do is be 50 and over to receive the mammograms. They also need to be residents of Louisiana, of course, and have no health insurance or are underinsured, which means they may have health insurance, but they don't have the coverage for pap smears or mammograms, or the woman cannot afford the cost of deductible.
In a few weeks, the Women's Preventive Health Program will have clinics available in every region of Louisiana. The national average for when a woman finds a lump in her breast until it's diagnosed is 29 days. And ain't just 4 weeks. Anguish for a woman waiting to hear if she has cancer. Now new clinics hope to cut that wait to 5 days. The Lisa Latta Tansy Breast Center at Oxnard is one of them.
And the average woman who develops a lump or develops an abnormality on a mammogram, between that moment and the time of diagnosis, most women will rank that as some of the worst stress they have ever known.
The breast center has expert radiologists who only read mammograms and surgeons who are steps away. The center also has new technologies such as the latest biopsy rooms and a computer that warns mammographers to double-check a suspicious x-ray a second time. The tools are in place to win this battle against breast cancer. Now the choice is up to you. The doctors, the nurses, and survivors we've talked to say if they can convince one woman to take steps toward early detection, then maybe they can save a life. Take control of your life and take care of yourself without fear. Good night.